MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Good evening. Welcome to Direct Connection. Coming up tonight, we'll get answers to the big questions surrounding stimulus checks, possibly a second round of stimulus checks. That is ahead. First tonight, the assault on Maryland nursing homes by the coronavirus. 1,300 people have lost their lives among residents of Maryland nursing homes. Thankfully, one nursing home fighting that trend. Joining us is the home's director, Derek DeWitt, who is also the pastor of the First Mount Calvary Baptist Church in Sandtown, Winchester, and director of the Maryland Baptist Aged Home in Baltimore. Sir, thank you for being with us. What was your approach when this outbreak started?
Thank you for having me, Jeff. Our approach was simple. We knew we had to act fast when we first heard about the pandemic. So immediate mitigation was our focus. And the way that we decided to do that was we knew, first of all, we had to shut the nursing home completely down and to limit our exposure to the outside community. So we did that very early in the process. We also limited our residents' travel outside of the nursing home, only appointments that was absolutely crucial to their health. We eliminated all of our outside vendors coming in, and even our workers, our employees who did not have direct contact with our residents were not allowed into the building. I'm the director and CFO, and I haven't been inside the building for 11 weeks.
Still, you have a couple dozen nurses, other workers there who, go home at night. Were they restricted at all in what they could do to prevent them from accidentally bringing it in?
Yeah. So what we did, we mounted a very rigorous educational campaign with our employees, and we encouraged them to exercise social distance even when they're in their private and personal settings, because they have to come back to work. And so we met with little or no resistance in that regard, and folks have stayed and limited their exposure to their own families for the safety of our residents. So we appreciate the effort of all of our employees to their labor of love, and even their sacrifice to even stay away from their own families so that our nursing home family can remain safe.
The state is starting to loosen up a little bit on visits. If there's an outdoor area where people could gather at an appropriate distance, do you have that ability?
Well, we are not going to loosen many of our restrictions that we have at Maryland Baptist. One thing that we have done, we have allowed family members to make appointments for visits that they can visit, and we bring the resident to the porch on the outside and allow the family members to stay in the yard. So they're quite a distance away, probably 18 feet away from their family member in which they can visit, but it does allow them some face-to-face contact with their family members. But other than that, we're gonna maintain status as it is. We're gonna keep the nursing home safe and secure and locked down until we have better optimism as far as what the coronavirus is doing and is going to do.
And you're not just the director there, you're also a family member because one of your aunts is a resident, right?
Yes, that's true. Yes. So so it's been a personal experience and difficult for our family as well, not to be able to have that human and face-to-face and close personal contact. But we have instituted Zoom and Skype and FaceTime calls for family members, and now they can have the porch visits, which we're hoping. But one of the things that we did, we had to make sure that the mental health of the residents were was looked after as well. So we increased our activity staff, and we also made sure that all of the residents had televisions, and so we increased the amount of time that we spent individually with each resident. So that was very important to us as well.
Well, if any of those television sets in the home are turned to public TV right now, what do you want the residents to know about how the community and the church community are behind them?
Well, we want them to know that we see them as our family. Many of our residents, we have residents of all races and colors and nationalities, and we want them to understand that they are our family. Many of them, we are the guardians for them, and we take that that very sacredly. So we want them to know that we love them and we care for them, and we're doing what's best for them, regardless of what the everyone else is doing. We're going to do what we feel is best for the population of people that we have, and we just encourage them that things will get better, that we serve a good God, and that trouble don't last always, and this too will pass. So we just have to hang in there and stay the course until, but there are better days ahead.
Pastor, let's take a phone call for you. This is Bridget in Howard County. Bridget, thank you for the call. Go ahead.
Hi there. I'd like to know if Maryland has any rapid testing for the virus, so that if workers go off and go places, especially young people, that when they come to work, can they be tested, and can you find out quickly with rapid testing? And if Maryland doesn't have it, why not?
That's a great question. Reverend, I don't know what you have access to at the home, but certainly there had been reports early on in this of shortages of not only testing, but protective equipment.
Well, the National Guard has taken over the testing for the nursing home. So through our National Guard liaison, we do have rapid testing, and we can get tested relatively quickly and get the answer back relatively quickly. We, in the very beginning, another measure that we took when we shut the nursing home down was to stock up on PPE. But with the National Guard assistance and the state and the city helping to pitch in when we need that done. We're a small facility, so we never anticipated running out of PPE. But yes, we can have rapid testing now, and we do have adequate supply of PPE. And one of the things that we do when our employees come to work, we have a questionnaire that questions their daily activities from the night before to determine whether or not they can actually even enter the building.
How are your staff members doing? We've talked about the residents, your family, but the people working there are obviously, they're the front line. They're helping people get through the day, but they're also at risk. And we look around the state, there've been a dozen or more cases, I think, of staff members who have not only caught the disease but succumbed to the disease.
Yeah, so our staff members are obviously, Jeff, they're tired and they're worn, but they're not discouraged. They love what they do, and they are making the necessary sacrifices to keep our residents safe. And we are very, very proud of what they do. I wish I was one of those conglomerate nursing homes and not just one single small independent nursing home, so that I can give them the bonuses that they deserve. And I think it's just an awesome, awesome accomplishment to be able to say that none of our residents and none of our staff have contracted this deadly disease. And it's all because of the diligence that they and the love that they bring to work with them every day.
Let's take a phone call. This is Bruce in West Virginia. Bruce, thank you for the call. Go ahead.
Hey, Jeff. How you doing? I went to visit my mom today. She turned 89 years old today, and we had to visit on the outside in 90-degree heat. My question is this: why can't we simply go inside and have that visit inside for 20 minutes instead of standing outside or sitting outside in the 90-degree heat for the residents, especially when they're older patients. Thanks for taking my
Bruce,
call.
glad you got to have the visit. Thank you for calling. Pastor, your thought on it's an interesting question because you're not only the director of this, you're taking care of people's spiritual needs as well. You know they would like to get closer, but I guess it's based on what the public health authorities say.
Yeah, that's a large part of it, what the public health authorities say, and what our director, our medical director says. Our medical director, Dr. Narendra Barrage, has just said that there'll be no visitors. And Bruce, congratulations to your mom and happy birthday. But I want to the thing that we need to understand about this disease, if we thought that there was a 98% chance that your mom would not contract this disease with your visit, but there was a 2% chance that she could, we would still not allow you to visit because your mom's life is not worth the 2% chance. So we have to make sure that we keep her safe above all costs. So we wouldn't even take the 2% chance that she might contract this deadly disease. So I know it's hard not to have that indoor visit. It's just safer outdoors according to CDC guidance, and it lessens the risk that you're going to affect her or vice versa. So we just would encourage you to be patient, and soon you'll be able to visit again.
Reverend, just a couple minutes left. Folks may remember in my introduction that your church is in Sandtown, Winchester, well-known community, North Baltimore, northwest side of Baltimore. What's life like in the neighborhood now, and how are churches, including yours, working to improve things?
Well, I am the president of Clergy United for the Transformation of Sandtown, and churches have really taken a beating as it relates to, us being, our buildings being shut down as well. But we've had to continue to provide critical services for our community that would otherwise go unserviced. So we even now, our Clergy United for the Transformation of Sandtown has partnered together to make sure that we are distributing food 7 days a week within the Sandtown community. So folks always have food. We're doing walk-up testing within one of our churches. And so we have had to do a lot to make sure that our community is kept safe. And we do it with this cloud of systemic racism that have led us down the path of being even more vulnerable than other populations because we have a lack of access to quality health care, a lack of access to quality food and education, crime, the list goes on and on. So churches have had to bear the brunt of making sure that these communities get what they need. So hats off to our churches, and we hope to continue to do what God has called us to do, and that is to take care of people.
All right, and if anybody wants to get in touch with the church, First Mount Calvary Baptist in Sandtown, Winchester in Baltimore City. Of course, you can find it online. Reverend DeWitt, greatly appreciate your time. Congratulations on all your good work.
Jeff, thank you for having me, and God bless.
Take care, sir, and Direct Connection continues right after this.
Drop your phone and just be in the moment.
You guys ready?
Yeah!
It's a thrill to see images of a new world for the first time.
I want to look back and say, I learned something. That is where transformation happens.
I see people cry on this show, and I'm like, what y'all doing, man?
Out of the water came this giant thing.
That's incredible.
I feel it in my bones.
It's so totally amazing.
They hear that song and they're like, that's my story.
I feel it in my bones.
I have chills.
All of the joys, all of the sorrows.
This is where it comes from.
The rest is history.
Joining us now is Susan Francis, Executive Director of the Maryland Volunteer Lawyers Service. Susan, nice to see you. Thank you for being with us. A number of things happening that affect many of the people you work with in terms of the stimulus payments going out, tax deadlines being deferred. Unfortunately, so many people having to file for unemployment. What are the biggest issues that you're seeing right now?
So one of the biggest issues we're seeing right now is the really being able to maximize the stimulus payments. Some of the other issues, we're waiting until the moratoriums start getting lifted throughout the state around foreclosure, collections, those sorts of things. But right now we've been really focused on making sure that everyone really is able to maximize that stimulus payment. We know folks really need these funds, particularly if they've lost their jobs, trying to make sure that we can help stabilize families throughout the state.
What are the main issues with the stimulus checks at this point?
Well, let's start with that. Stimulus checks. That in and of itself is confusing. I call it stimulus checks as well. It is technically the economic impact payment, and that can come in the method of a direct deposit. It can be a prepaid debit card, or it can be that paper check that we all envision when we hear about the stimulus checks. It can be really confusing about what folks do or do not need to do because people are kind of segmented in a couple of different areas. And getting the economic income payments can be really important. It's $1,200 for an individual, $2,400 for a couple, and then $500 per dependent child. And the income threshold for qualifying is quite high. So most of us are going to be able to receive our economic impact payments. So there's really 4 categories, and you got to figure out where you fit within those categories. If you're in the luckiest group, you filed taxes last year and you got a refund last year. And so the IRS has your bank information. They have all your current information, and you likely would have already received your direct deposit into that bank account. If you filed taxes last year and you owed money, then they don't have your bank account. So you're likely going to get a prepaid debit card or you're going to get a check. But one of the things you want to be very careful about is if you got an anticipated refund loan, which means you were anticipating a refund, one of the tax preparers essentially loaned you the money ahead of time, they're not going to have your bank account. They're going to have the bank account of your tax preparer, which means they're going to receive your stimulus check, which is probably not where you want your stimulus money to go. The third category is if you aren't a filer and you receive some sort of government benefits, you should be receiving your stimulus payment in the same way that you receive your benefits. And so we're talking about here all the Social Security programs, retirement, supplemental income, disabilities, survivor benefits, VA benefits, railroad benefits, any of those sorts of programs. And the IRS is saying at this point that they have made all of those payments out. And then the last group's going to get left out unless they take a very specific action. So if you don't file taxes, so say your income is low enough that you don't have to file taxes, and you don't receive a government benefit, which that encapsulates a lot of people, the government's not going to know anything about you, and they're not going to give you your stimulus funds unless you proactively go to the IRS website and you file a non-filer form. And that's a very modified tax return that's going to notify the IRS that you're out there and that you can receive these funds. So those are sort of the
Susan,
4 different groups. Yeah.
I was going to ask you the last category. Is that a group of people that would be eligible for your assistance, and what can you do for them?
Absolutely. We have a tax hotline. And so throughout the regular times, we help with tax controversy issues, but we have shifted our priorities. And so we have a tax hotline, and there's two things we can do. If you haven't filed your taxes yet for 2019, we can help you do that because we want to make sure you get your taxes filed so you can maximize your return and make sure you're getting things like the dependent child credit. We also will help you with the non-filer form. You don't need an attorney to do that. You can just go to the IRS webpage and do that yourself. But if you're having trouble navigating just how to do that with the questions that they're asking, we have attorneys that will help actually answer those questions, walk you through the process, try to make sure that you get that form filed.
I've seen that some people have been tripped up by the way the debit cards are shipped, which apparently is a plain envelope. Maybe it says Treasury Department, but there's no big writing that says here's your money. And apparently some people have missed it or recycled it or whatever. Are they out of luck?
They aren't. The good news is they aren't out of luck. The bad news is in a normal world, if someone gets a plain paper envelope that has some sort of card in it and it has no identifying information on it, we would want them to cut that thing up and throw it away because that's normally going to be a scam. This would be the one exception to that rule. So what happens is you're exactly right. It's a plain white envelope. It doesn't say anything about the Treasury Department. It doesn't say anything about stimulus payments, economic impact payments. On the outside, it has the phrase, the return address is Money Network Card Service. And the bank, which is on the back of the card, is Meta Bank, M-E-T-A Bank. If that's coming in, that should be your legitimate prepaid debit card. If you have thrown it away, which unfortunately folks have done, what you need to do is you can call the customer service line and let them know that it has been either lost or stolen. And let me get that number for you. It's 1-800-240-8100. So as soon as you realize
how did you find that? If somebody's Googling, what do you type in?
Yes. So there's actually the IRS has a helpful economic impact payment website. And let me get that for you as well. And they have a lot of frequently asked questions on there where they can help you navigate some of those issues. And so if you go to the IRS, they have a coronavirus section and they have economic impact payments. And there they can advise you about if you've lost it. One of the other issues we see is how to, with these prepaid debit cards, they can have fees attached. So how to use your card as a debit card as opposed to a credit card to avoid any fees. It also has instructions on there about how you can transfer it to a bank account as opposed to using it as a debit card. So there's a number of kind of frequently asked questions that's available on the IRS.
I was going to ask about the risk of scams here. They're talking about maybe a second round of stimulus, maybe more economic impact incentive payments. And with the level of complexity you're describing, you could sort of see that opening the door to a scam artist calling somebody up and saying that I need all of this background information. I need your bank account, your social security number before we can send you the money. How can people avoid falling into something like that?
That's a great question. Unfortunately, in times like this, we see some really bad actors trying to do some really bad things, and this is rife for opportunity for scams. And it's a time in which we're all much more socially isolated than what we normally would be. So particularly for older adults, for example, who are targeted for scams and might be more vulnerable for believing scams. Right now, how do they show it to a family member when they can't, when they can't come over to visit them? So, you really want, everyone should really Be very cautious about anytime anyone's asking you for any information. There's very specific ways about how these funds come to you. No one's going to call you and ask you to verify anything. So someone's asking you to verify your bank account or your social security card. If they're offering to help you to get it faster, if they want you to go to an email or a website, again, to provide information, those are all scams. We always encourage, particularly for older adults, but just anyone, if you get something that just doesn't feel right, ask a family member, ask someone else what their experience has been, and to get some guidance before you start, providing some information out that can be really damaging to your income and your bank accounts, all of those things that once they're gone, it's nearly impossible to get it back.
Good advice from Susan Francis, Executive Director of the Maryland Volunteer Lawyers Service. Susan, thank you for your time.
Thank you.
And that's our program for this week. Remember to follow us on Twitter at MPT News. Now, for all of us at MPT, I'm Jeff Salkin. Thanks for watching and have a good night.
This program was made by MPT to serve all of our diverse communities.